Okay, so hey kids, I know y'all talked about intake and output and catheter care and all of that in the classroom, so now it's time to demo the skill for emptying a urine collection bag. This is also called a Foley catheter bag. So as always, you're going to gather your equipment first, so you need a graduated container of some sort, and you'll find this in the patient's room, usually in the bathroom. So, and you'll need some paper towels, and you can get those in the patient's bathroom as well. And remember to always do your pre and post procedure guidelines too. So here we go. Knock, knock. Hey there, Mr. Johnson, how are you doing? Oh, okay, well, good deal. My name's Lynn, I'm a Hartselle High School student, and I'm gonna empty your catheter bag, okay? It's getting kind of full. Can you tell me your name and birthday? That's right. Okay, so you want to make sure when you empty the bag that you put some paper towels down to catch any kind of spillage, any splatter. And then you put the urine container in close proximity. So I'm gonna raise the bed up because I'm gonna let it keep hanging. Urine bags should hang from a little hook under the bed, and they all have they all look a little different, but they're made the same. Oh, heck! Time out! You don't have to stop it. Let me get some gloves on. As soon as I touched that nasty spigot, I thought, oh, I don't need gloves on. Look, this can happen. Just put you some gloves on, okay? It's no big deal. Put you some gloves on. Happens to everybody. And I don't know, these are in the small box, but I don't think they're smalls. Oh, they're large. Yeah. All right, so back it up. Put your paper towels down to catch anything that might spill. These bags they're all similar. They may look a little different, but they all have a little spigot with a clamp, and you're just gonna unclamp it and just make sure it's aiming into the container. You may have to tilt your bag to get it to, empty completely. And these may be emptied once a shift, twice a shift, or even more than that if your patient's on some sort of diuretic or whatever. Clamp it back and then put it back into the little holder spot. All right, now you're gonna take your urine to the patient's bathroom, which I'm gonna pretend's right over here. And you're gonna sit it on the counter, and you're gonna read it. See how many milliliters? We're gonna read in milliliters and not ounces. So you're gonna get down at the meniscus, read at the meniscus. Remember, that's the middle of the dip. So this is right at 200 milliliters. And sometimes if it's graduated like this, you have to kind of guesstimate as close as you can, because look, that's only 200 and then 225 and then 250. So it's not, graduated all the way. Then you're gonna pour this in the toilet and rinse it out and store it in your patient's room. All right, so let's pretend like we've taken care of that. Come back in here, take off my gloves the right way, dispose. Dispose of your gloves, use some hand gel, and then do all of your post-procedure guidelines. So lower your bed. Do you know how to work the call bell? Yes, I do. Well, all right. Somebody will be in here to check on you a little bit later on. If you need anything, you just push that little buzzer, okay? Are you comfortable? Yes, ma'am. All right. Well, I shall see you later. And that's how you empty a catheter bag. So if you have any questions, just ask your instructors. I'm sure they'll be happy to answer anything you might want to know. Thanks.